Well, this year's flu season has reached the epidemic level, and many emergency rooms around the nation are seeing an increase in flu-related cases. Dr. Nilay Shah is a neurologist and director of medical services at Integrated Medicine and Nutrition at Mount Kisco, and he's joining us here in the New York studio. Hello, Dr. Shah. It's good to see you.
Great to see you again.
You know what? We've been hearing about it for quite some time, and I don't know if it's because this year's vaccine is only marginally protective of the strains of flu that are out there, but this has really been a tough flu season.
It happens every year. Unfortunately, with the American public, we have to really stress the importance. That's why it's always called an epidemic. Unfortunately, you know, many children die, elderly people die, and if we don't stress the importance of getting vaccinated and taking protective measures towards it, people can die of a disease that's very preventable.
Very preventable indeed, and as you said, the most vulnerable are the oldest and the youngest in our population. But I think many people are asking, is it worth getting the vaccine if it is only limitedly protective?
Absolutely, because even if it protects a few small percentage of people from getting the flu, they then spread it less to their friends and families, and so overall the impact of the disease is much lower on the whole population.
All right, let's move on and talk about a couple of other topics. There was a report out about clinical depression worldwide, 350 million cases worldwide. Gosh, what do you make of that?
I think part of it is we're living in a tough world, but we're also recognizing psychiatric conditions more clearly and carefully. It's a matter of really looking for things and not just poo-pooing them anymore.
You know, over 1 million people die due to depression-related suicide or substance abuse that complicates it. How can we as a society address this and curb this number?
I think starting by talking about it, you know, opening up the conversation, recognizing that it's a problem that can be addressed, and if you do address it head on, you have your friends, your family, your loved ones, treatment, whether it's medication or other approaches, that can really make a difference and bring it down to a more manageable disease.
How is there a connection between immune disorders and depression?
Well, unfortunately, with autoimmune diseases and your immunity being less strong, through the use of various too many antibiotics and stuff like that, you're more susceptible to get any sort of illness. And when you get sick, whether it's a headache, a cough, a flu, you're down in the dumps. So the more often you're sick, the more often you're down in the dumps. It's a cycle that feeds on itself almost.
What are the best therapies out there that the medical profession has to treat depression?
Well, I think that there's a whole range of approaches, and I think a multimodal approach is the best. Using medications when appropriate under the guidance of a doctor, but also doing behavioral changes, therapeutic interventions like finding a hobby or doing something more regularly with loved ones or with friends, as well as eating well, exercising. Exercising brings on a lot of antidepressants that are internal and automatic and can really make a difference too.
You get those endorphins flowing.
Exactly.
And the social component is very important, isn't it?
Truly.
Having relationships that in a support system.
It's too easily, we're isolated in this community very easily. You get behind a computer, you're sitting on the internet, and the next thing you know, you really haven't seen an actual human being for hours or days.
That's incredible. Let's talk about a new study that came out about colds. In the medical profession, because I went to veterinary school, I've always thought that cold weather has very little to do with catching a cold. Now the study says it might have something to do with it.
Your grandmother was right.
Yeah.
It's absolutely true.
Bundle up, honey.
Yeah, a study at Yale showed that the most common virus, the rhinovirus, that causes the common cold actually does better in cold weather in terms of replicating. So at normal human body temperature, compared to just a few degrees lower, it replicates faster. Secondly, your immune system and your immunity against this virus is lower in cold temperatures. So it's up to 100-fold increase in how virulent it gets just by being in the cold.
So is it enough literally to, to bundle up and cover your nose when you go out in that cold weather?
Absolutely. That covering your nose with a scarf can change the temperature by several degrees and reducing the impact of the virus.
It never fails. Mom is always right.
Yes,
very quickly, before we run out of time, the FDA has approved a new weight loss drug. Tell us about it very quickly.
Well, in a nutshell, it's a much more specific hormone in the brain to make you not as hungry. Your body feels full, your brain gets the signal saying, okay, I've eaten enough. Used in conjunction with diet, exercise, and appropriate methods, it works.
Is it looking promising and healthy? Because there have been other weight loss drugs that were pulled off the market because of bad side effects.
Sure, this is much more specific to the exact mechanism of hunger.
Yeah, and I'll give it the name. It's Saxenda.
Saxenda?
Okay,
Yeah,
Saxenda
like
for those who want to know. Dr. Nilay Shah, it's great talking to you as always.
Pleasure.
Thank you, sir.
Thanks.
And you're watching Arise America.